All right, guys, thank you so much for joining us. We are 2 minutes past the hour, so I'm going to go ahead and get started. My name is Natalie Haywood, and I'm with the Texarkana USA Chamber of Commerce. I do all of our events and communications here. So anything like this that we're going to do today, I try to help coordinate all of that, find speakers, and get us going, and try to get some of you watching. So thank you for joining us today. You can see in the comments, we should be able to see your comments on our end. So if you can just let us know where you're watching from on your Facebook comments there. We would love to see that, and we'll try to respond if you have any questions. And if it looks like we're not responding, then we might not be able to see them, but we're going to try our best. This is the first time using this, so we are feeling our way through it, so just be patient with us. So I have the pleasure today introducing Dr. James Raker. He is been practicing private practice in Texarkana at Arklatex Health Center for over 30 years. He was one of the first doctors in the country to become a certified medical examiner for the Department of Transportation to perform DOT physicals in 2015. He became a certified wellness professional and started OCMED for Doctors of Chiropractic, which is a teaching program for chiropractors to be knowledgeable in occupational medicine, to help businesses save money on physicals, drug and alcohol testing, COVID testing, work comp injuries, and much more. This is pretty cool. He's one of only 3 doctors of chiropractic to hold a ring doctor license for professional boxing matches, and has presided over more than 300 fights. So that's pretty neat. If y'all can just help me welcoming Dr. Raker. Hi, Dr. Raker. How are you this morning?
Hi, Natalie. It's nice to be here.
Yeah, thank you for joining us.
We're going to have a fun show today and hopefully answer some questions for companies on what to do with this COVID pandemic, how to handle employee absenteeism and sickness. There's a whole lot of different scenarios that are going on here, and I know that companies are sometimes having a hard time dealing with keeping enough employees. You know, I only have about 10 employees here at my clinic, and just keeping 10 people here and working and going is pretty hard to do. So I can imagine some of the strife that some of these larger companies can have if you have more than 10 employees, just keeping the wheels turning. So hopefully I'm going to give you some good hints today on how to handle that.
Awesome. Well, that sounds good. Yeah, it's difficult. It's like, I mean, with it being so contagious, once somebody gets it, it seems like everybody's going to get it. So what we can do to prevent that is, that's what we're here to learn today.
Exactly. So let me kind of just get into a couple of things, and then you can stop me or ask me some questions as we go along, or if anybody else has questions. Let's start with, the fact that, yes, COVID is a virus. It's much like the flu. It's airborne. It's transmitted by not only airborne, but touching things and then touching your face. So, the general idea is to try and eliminate the airborneness and moving it from an object like a tabletop to your face. So the very first rules that the CDC and everybody came out with was let's wear some masks, let's try and clean surfaces, and the very probably number one rule of thumb is never touch your face with your hands. That's how some of the transmission occurs. So unless you just sanitize with alcohol or wash your hands really well, don't touch your face. And I know that's hard to do. Everybody has a little itch, a little scratch, trying to move your mask around. But really, the whole idea is not to transmit to your face, because that virus, once you touch your eye or your nose or your mouth, the virus can get in those mucosal membranes and in it goes, and then it starts. So the masks help. Now, are they 100% effective? No. And there's these people who are going to argue that, the virus is so small it can go through any of the pores in the mask. And that would typically be true, except if everybody's probably been in a circumstance where someone has sneezed and the sunlight was such behind them that you could actually kind of see the mist and the spray. So you've seen this kind of drawn on cartoons, but you've probably seen it in real life. When you sneeze and expectorate those particles, it's not that you're expectorating just a single virus. You're expectorating a droplet of water, which is magnitudes bigger than a virus. It contains the virus. the whole point of the mask is basically to try and catch those droplets. So much like before Corona, everybody was kind of being taught, if you're going to sneeze, cover your mouth, cough into your sleeve to try and keep that from going everywhere. And even now with Corona, it's a little more important to try and catch that. So the masks are what that's all about, is just to catch those droplets. We know that there's going to be some that's going to escape unless you have a really tight-fitting, well-worn mask, but it's going to help. So that's rule 1. And then washing and sanitizing hands is rule 2, and not touching your face is going to be, rule 3. They all work together to try and kind of slow down the transmission rate. Any questions about that so far?
No, I think that's pretty self-explanatory. It's pretty amazing what I was talking to a doctor the other day, my pediatrician, and she said we have had no RSV and very few flu cases, and I really think that's attested to wearing masks.
It is
with protecting from COVID.
There's a whole lot of things that changed with COVID, with everybody staying at home and not driving as much. The insurance companies are actually saying that their rates of like car wrecks and other kinds of accidents, falls, whatever, across the board are down. And it's because people are not out moving around as much. So we're not seeing that. We're just kind of dealing with, these respiratory illnesses. Now, some people are going to get probably tested for COVID. And if it's positive, they're going to stop there. Some people, one of the big problems with COVID is once you get COVID, you can then contract these other diseases like pneumonia or flu or other diseases. And that's what kind of snowballs and makes someone go downhill to the point where they're in the hospital. So sometimes there's probably some flu cases that are starting up now that are just undiagnosed. We have a lot of COVID tests that are COVID people that are positive that are undiagnosed because they're asymptomatic. Now, I myself got COVID about a month ago. We test our employees every month. So I was negative at one testing point, and then when it came around to the next testing point, it said, you've had it in the past several weeks and you're already over it. And I really didn't know. I think I had like maybe a couple of times that I coughed that was a little more than kind of just an average daily thing. And that's all I knew about it. I ran no fever. I had no other symptoms. So I was one of the asymptomatic people. And that happens so often with this. They're saying in the neighborhood of 80% of the people that can get this can be asymptomatic, be walking around, talking to other people. You don't feel bad. You don't run a fever. And yet you possibly could be, extruding that virus out to other people, which then get it and get sick and maybe get really bad.
Right. And that's, that's the scary part of it, is that we don't know a lot about it, and we don't know if it is being transmitted, and it affects people so differently.
Yep, this is kind of new, and we only have other things to go by, but this one's kind of odd. Yes, it is the highest death rate is among the 70-year-old plus, so it's kind of like the flu, but it has gotten into and killed some people even down in their 40s. I don't think, if there's been any like childhood death from this, it's been maybe the very, very young infants. The death rate in the younger kids is pretty close to nil. It's really hitting hard the older ones and a few of the middle ones, maybe that have like other comorbidities like diabetes, high blood pressure, maybe a faulty immune system. They're all going to be more susceptible to this and probably get it a little harder.
Yeah. Well, let's go into what we can do as employers and figure out how we handle that on our end.
Yep. Now, there's a lot of scenarios that come into play here. Let's say in general, first, it would not be a bad idea, because there's so many asymptomatic people, to screen your employees with, say, an antibody test once every month or two, as just kind of a good basic screening. If that's possible, that's a good way, because you can catch some of these asymptomatic people and have them sit out in quarantine for a few days before they bring it and infect other people, which would then slow down work and production. So that's probably number one is to try and do a little preventative screening.
Do you do them all at the same time every month? On the first of every month?
Yes, typically you'd want to just kind of run through and do everybody. If you stagger it, then the ones you're not doing, if they have the virus, then they're passing it around to the other ones. And you just kind of run through and try and test everybody and at least see if there's anybody positive at that point that you need to quarantine out.
Okay.
Try and keep the other people safe and away from them. And if you do that on a routine basis, you can kind of weed out and catch some of what's going on with this. It's not a perfect system. I mean, the only way to do this perfectly is to literally test every day, and that's going to be impossible. That'd be too time consuming and too money consuming, too expensive. But if you do at least a routine test, maybe once every month or two, that would not be bad. The other thing is obviously there's been some rules put in place to try and take temperatures and discuss it and have like the employee fill out a symptom sheet if they're feeling any symptoms. The weird thing about COVID is, just like we talked about it being, you can be kind of asymptomatic and not have any symptoms whatsoever. It can also kind of run a little gamut of, you might have a little fever, you might not. You might have a headache and you think, well, it's just a headache, but it could be COVID. Could have some GI upset, little tummy upset, and not really too bad, a little diarrhea or something. It's all these little symptoms that are kind of day-to-day symptoms. But again, think of COVID as it's a virus, just like the cold virus, just like the flu virus. So it can kind of create these little symptoms that mimic every other virus. So anything that, if you just don't feel normal, and especially, the really almost diagnostic without a test is losing your sense of taste and smell. If you lose your sense of taste and smell, I probably don't even have to do a test. I can just say you have COVID. That is so diagnostic for this particular disease. But anything that feels a little weird could be COVID. Then the question is, if you're walking around with it, are you giving it to anybody and everybody that you're touching and being around? So again, besides a little routine testing here and there to try and sort out some of these asymptomatic people and let them sit out for a while, is doing the fever and the symptom screenings. Now, let's say someone has a slight fever or a symptom. What can a business do with this? The next thing to do would be have someone to work with, a doctor. I've been doing this for some companies where we would do like televisits and actually they would turn the person away from work, say you can't come in here until you get screened by the doctor. Then they would call us. We would do a little televisit to start to ask the questions of, what's going wrong? What are we seeing? Sometimes this can be discussed and figured out really quickly that it's not COVID and you can go into work. So that saves, the company from having somebody off work for multiple days. And obviously, probably the employee wants to make a paycheck, so it gives them the opportunity to work quicker. Now, sometimes the symptoms may be we can't tell over the telephone what's going on. Maybe we have to have you come in and physically look at you and do a COVID check. Either way, that would then speed up the process. If we do a check and it's not COVID and it's something not infectious that we can handle, then they can go back to work. Maybe 5 minutes. They could go back to work quickly without losing a lot of time and without the business losing a lot of manpower. So part of the services and the things that can be done from a business standpoint is, screening through testing, screening through daily temperature checks and symptomatology. If someone has a temperature or symptomatology, getting them to someone, primary care, that can kind of sort out what's going on. Is it infectious? Can it be dealt with and then get back to work quickly? Or is it infectious and they need to stay out to keep from, kind of quarantine them to keep them from being amongst the rest of the workers? So all these things together can kind of keep the wheels rolling a little bit smoother and faster without a lot of guesswork. In the beginning, every time somebody came up with a problem, it was just go home and quarantine for 2 weeks. So the companies all lost workers for a full 2 weeks, when really some of those were not COVID, maybe not infectious at all, and could have been working after a day or two and make up the manpower. So hopefully that gives a little bit of some input to companies to help them realize they can control this a little bit better with a little more hands-on from HR. And you just have to have a working relationship with a physician that you can, start to call, do some televisits, do some testing when needed to try and keep these gears moving for the company a little bit better.
Okay. Well, I'm not sure if you can see here, but we have a few comments and questions. From Latanya, do you know any about accessibility for antibody tests and or resources for those across the country? They have employees not just here, but across the country.
Sure. I mean, literally, there's 3 different kinds of testing. There's the PCR testing, which is more about finding the DNA, RNA of the virus. There's antigen testing, which looks for the protein code of the virus. And then there's antibody testing, which once the virus gets in you, just like the chicken pox or measles or any other disease, your body starts to make antibodies, and the antibody test looks for those antibodies. So, and we're going to have a little graph here that we can go over the time frames of which test is the best to use at what time frame for the person. But the short answer is all of these tests are, everywhere in the country. You shouldn't have a problem finding someone that can do some testing of any sort. I actually, because I teach this occupational medicine, I actually have a network of about 200 doctors across the country. I may have one in the city that you need that I can put you in touch with. But even if not, there should be someone, because this is now so widespread. All the doctors in the facilities are getting all these different tests, and it should be pretty easy to find and get some outsourcing done for that kind of testing. Now, obviously, let me add this at the moment. If the person has symptoms, or if you have employees that was exposed to someone that was positive, let's say Mr. Joe calls in and says, I'm sick today, I'm not coming in. I went to the doctor yesterday and I tested positive for COVID. But now Joe has 10 people that work really close to him in a room where they're all together. So he's been working with them for the last 2 or 3 days. They've been exposed. So now the question is, we need to test them pretty quickly to get, if any of those are positive, get them out of the workforce before they infect everybody else. So when someone has symptoms or has been directly exposed to a known positive person, their health insurance is mandated to pay for a COVID test and an office visit for free. It should be no deductible, no copay. It's free. So they can go, and this is where if HR had, a doctor to go to, you can just say, go straight over there, have them check you, do a COVID test so we can find out if you're, if you are contagious and or not. So working with someone like that, if you leave it up to them saying, go to your primary care, here's the problem. Primary care is so full taking care of sick people, I can't get an appointment for 2 weeks. What good is that? So you got to have somebody that's more working on a fast occupational nature directly with the business to try and get this done. So hopefully that is the relationship that these businesses and HR can develop with a doctor that can be more their personal company doctor to get things done fast.
And you're saying like you're able to send 30 of your employees immediately to that doctor and get them all tested as soon as someone tests positive.
Exactly. You want to just send them, get them all tested, and get them sorted out so that if anybody's positive, you pull them out before they give it to everybody else, or else the whole thing is going to be down. Everybody's going to be sick at once, and there won't be nothing moving in the company for a week or 2. So if someone comes to work, or let's say they call in and report sick, and there's other people that need tested, you can at least now know, you can tell them if you have symptoms or if you've been exposed to a positive person, your insurance is supposed to pay. If you don't have insurance, there's a government program where the government will pay for this for free. So in those scenarios, there's no cost or expense to the company. Now, let's say someone tested positive a week ago or 2 weeks ago. They've kind of done their 10 days or 14 days, quarantine, but the company's still like, you really need a test to come back to work. We need you to show that you're now negative. Again, this is where you've got to have a facility or doctor that you can call, get them in, get them out quick, so that they're not waiting another 2 weeks to try and get a test. Now, in this scenario, though, without having symptoms at this point, because they're past the infectious point, and the insurance may not pay for that. They may say, the CDC has said, if you've tested positive, you've waited 2 weeks, you're done and over, you're not contagious, you can go back to work. But if a company feels uncomfortable and they want to have a test done, this is where we have to say, look, insurance may not cover this as a return to work test. This may be something that the company wants to work out with the doctor or facility and to say, if we need return to work testing, we know their insurance is not going to pay for it. We don't really feel like we should ask the employee to pay for it, so the company wants to pay for it. That's an easy way. I've worked with a lot of companies where I could provide some quick, easy testing at maybe a discounted rate for the company if they're going to pay for it. So that's another relationship that you can form to speed up the process. And yes, that one costs the company a little money, but you get a worker back, a lot quicker. So they may not be out for days and days.
Do you see some of your peers in the chiropractic world, you don't necessarily relate COVID testing to doctors of chiropractic, excuse me. Is that something you've seen across the country, that they're adapting and testing for COVID, or is this something that's unique to your office?
Well, it's not unique to me. There are some, and I'm actually teaching. There's a lot of my doctors as chiropractic, we're more concerned with musculoskeletal injuries and spinal hygiene and safety from that aspect. But I'm trying to teach them there's no reason why you can't be a cog in this medical part of the wheel. Testing needs to be done. I mean, obviously, we've got 330 million people in this country, and if everybody needed testing and everybody lined up, it would literally take months. So it's not like we have the facilities and enough people to do this. There's a demand. So it's one way that I'm teaching our doctors. You can take an extra step out there and do another thing that's helpful to the community, helpful to businesses. This talk today is mostly about COVID, but really, from our perspective, our profession, we've stepped out. I'm now the company doctor for a lot of companies, and I do a lot of things that would not be associated strictly with chiropractic. I've treated a lot of first aid, burns, cuts. Obviously, we're looking at sprains, strains. That's part of our normal general. But the burns, the cuts, and now this infectious stuff like COVID is it's like adding another little part and a little piece to the puzzle that helps companies keep the wheels turning. We've actually reduced work comp rates for many companies by doing what we do and reducing recordable injuries that really the medical docs can't seem to do, because the first thing they typically do is write a prescription. And the minute you write a prescription, it's recordable. My profession doesn't write prescriptions, so it keeps it non-recordable, and that overall reduces work comp injury rates and recordability. So that's a little off topic for the COVID today, but I want everybody to understand there's a lot more to encompass our profession than just back pain. There's a lot more that can be done by a good occupationally trained chiropractor like me and like what I'm trying to teach my doctors.
Okay. Well, let's jump over to your slide you have here. You're ready to do that?
Yes. This may answer some questions for employers. All right. So what this is looking at is, on the left-hand side is the 0 hour for getting COVID. Like, you bumped into somebody that had COVID and they sneezed on you. That's the 0 line at the far left. That's the starting point where the virus enters your body. At that point, you can see the two darker lines start to go up. It's going to take about 24 hours before there's enough virus and replication of the virus in your body to be able to detect it with one of these tests. So if somebody sneezed on you this morning and you were afraid and you went and got a COVID test like at 3 o'clock this afternoon, even if it was in your body, the test there wouldn't be enough of it there to pick up. So you probably get a false negative test. Now, after time, and as the virus builds up in your body and there's more of it, you can see those curves going up where the tests become more and more it says detection accuracy. It takes a few days for it to actually get up to that 100% mark. Now, the very first dark line is the original PCR test, which is where they shove the swab way up to the back of your nose. A little uncomfortable. It was the gold standard. You had to send it to the lab, and it took about 48 hours to come back. So as that line goes up, that test becomes more accurate and it starts to detect it. But then it takes a couple of days to get the answer. So you're already 2 more days down this line before you even know whether you have it or not. We really liked it as physicians when they came out with the antigen test, which is the second dark line. It very closely in time follows. It's a little tad slower, but these things are now a 10-minute test. So we get an answer in 10 minutes. You don't have to wait 2 days to get the answer back. So that's really, really nice. And the price is a lot lower than sending it to the lab on the PCR test. So that's a really handy test for when somebody is especially symptomatic right in the beginning. Now, you can see the red line that starts at about day 3. So about 3 days into it, your antibodies start to build up. But see, they're a little slow coming off the bottom, and it takes another few days. So the antibody test starts to kick in a little better at about day 5 or 6 and then swoops up. So you're going to pick up with the antibody test kind of the middle part of infection on. And the nice thing about the antibody test, where the other 2 tests go back down to 0 after, about in between 2 and 3 weeks, if you kind of felt bad a month ago, but you never really went to the doctor or got tested, you don't know if you had COVID or something else. The test you're going to do at that point is the antibody test, because as it goes up, then it stays up with antibodies. That's your immune response. And we can do the test at a later, even out, a month or 2 or more, and hopefully still pick up that you've got antibodies to this, so you can kind of know you had it in the past, even if you never felt bad. That's the test that caught mine. Is I never felt bad. We tested at one point, I was perfectly fine, and 4 weeks later we did an antibody test, and I was already way back on this backside where it said, well, you had this 2 or 3 weeks ago and you didn't even know it. But now I've got the antibodies. So kind of like with the measles or mumps and chicken pox, I can kind of walk through and wade through everybody else that has it, and I have no fear for my own self. So it's nice. I'm kind of past that point. But as employers, this is where you kind of can make a decision depending on when the person thinks they got exposed or when they had symptoms as to maybe which test to do. When we talked about doing a screening test like every month, I would use the antibody test. It's going to tell you if there was a few people that had it in the past that never knew they had it, and you don't have to really worry about them too much. And then if you do it every once in a while, it's still going to pick up some of these middle, early onsets. And then if somebody's symptomatic, though, we want to do the antigen test. It's fast. It's more primed to catch it right there in the beginning, so we can get an answer really quick. And all these tests are pretty accurate across the board. At least, they're not 100%, but they're pretty good. So they're going to pick it up.
Okay. And the antigen test is the rapid test. We had that question.
Well, the antigen test, it can be a rapid test. There is some antigen tests that you can send to the lab and it's slower, but they do make rapid ones now that are 10 minutes, and the antibody test is 10 minutes. The RNA test is the one that has to be unraveled by the lab, and that's the one that takes anywhere from 24 to 48 hours. And really depends on how backed up the lab is. The test itself doesn't take that long, but because of the volume, sometimes they're even backing up more than 2 days.
Mm-hmm. So if I'm exposed today, I get the phone call from my friend that I was around. We weren't wearing masks, or even if we had masks on. I was exposed today. Do I quarantine for these 5 days until I'm able to actually get tested, or do I?
Perfect question. Here would be my rules. What I would tell you, the general thing. Number one, because you don't know if you've got it or not, you don't want to accidentally pass it to anybody else. So you kind of want to, quarantine yourself a little bit, wear masks, wash hands, don't get around other people. You want to wait. If you think that the exposure was, say, 24 hours ago, if you're not having any symptoms, I would try and just kind of self-quarantine for about another 24 to 36 hours and get a test starting, you can see where those lines go up more at about day 3. So day 1, not real accurate testing. Day 2, it might catch it, but again, those lines are at the low end, not really super accurate. But by about day 3, it's starting to come up. Now, let's say you get a positive on day 3, well, then you know. But let's say you get a negative on day 3. The line isn't all the way up at the top, so there can be a false negative. So you want to get a test at day 3, but if it's negative, still use some precautions and maybe see how you feel. Definitely, if you have symptoms after day 3, go back and get another antigen test, because that might now, show up positive. If you're asymptomatic, you could, get one of the tests in after another few days, just for peace of mind, to kind of see, okay, am I really negative? But that first day to 3 days is kind of that point where you can detect some of this, but you can see that that's nowhere close to the top line where it says 100%. You're going to miss some. So you just have to kind of be, careful. If it is positive, for a fact you're going to be quarantined for, 10 to 14 days to make sure you don't give it to somebody. But if it's negative, I would still err on the side of caution and try and kind of self-quarantine and be very careful being around, especially older people, and then maybe retest somewhere about day 5 where it's starting to hit more of or 6 on that high end, just to be perfectly sure.
Okay. All right. We had a question. Let's see here. Again from Latanya. Are there any antibody test kits available, or do they have on-site testing through any national providers? And Latanya, I think I'm assuming that people come to your workplace to do on-site testing. And we'll wait for the comment to come back. But
well, I know generally we do on-site testing with both antibody and antigen. So usually if you have a provider that's equipped to do mobile testing, I mean, obviously you could send your employee to the doctor's office if they don't do mobile testing, and that's the only way you can get this done. But some of us are doing some mobile testing. In fact, I had 2 of my employees at a company this morning at 6:45 did 25 antigen tests to screen because they had a positive person. They wanted to screen a bunch of other people that were around. We were out there and we got 25 people done in about 40 minutes. It's pretty quick and easy once you get the line rolling. So it can be done mobile, or you can send them to the clinics and get them tested there.
Okay. Is that something you can research for us and find a national provider for something like that? Somebody that does the same as you, that does some on-site testing. That's what Latanya is looking for.
Sure.
Someone that's national.
Yeah, I mean, literally, other than the 100 or 200 doctors that I know in the network across the country that I've personally trained, which is, not very many sites in this big country, she can contact me and tell me a specific, city where her other site is. And if I have somebody that I personally have trained, I can hook them up and they can have that relationship. Or if not, the next best thing is just to probably Google COVID testing in that area, and it's going to pop up with everybody. Then it's a matter of just looking through the list to find out and calling, do they do on-site testing for a company? And then they find somebody that can cement that relationship.
Yeah, so just forming those relationships, that's the most important part.
Yep.
Let me see if we have some other questions on here.
I see a question about the accuracy of the finger blood test. Yes. As you can look at this graph, there's a starting point at about day 3 where they can start to pick up antibodies on some people, but it does not hit its, high accuracy rate until you get down the road at, somewhere between 7 and 9 days is where it really ramps up and they become highly accurate. So there's an accuracy rate of nearly 100% on all these tests at a certain point in time. That's why this graph is so important to know. It's the timing of which test to do at which point in the infection the person is to get the best answer. So the first 1 to 2 days is really kind of sketchy no matter what test you do. Starting with day 2 on, the the RNA test, the PCR test that's sent to the lab is first, with the antigen test right behind it. As it ramps up, they both become more accurate quickly. And then the antibody test ramps up and becomes more accurate from day 7 on, where it's ramping up. So it's that timing. Each test is accurate, but it's all about timing.
Yeah.
So hopefully that kind of helps clarify that a little bit.
Okay. How long are some of those antibodies in your system?
You know, we don't know how long they're going to stay there. This could be a lifelong immunity like measles and chickenpox and mumps, where they stay forever and your body recognizes and keeps this on file. Or there are some diseases that the antibodies really only hang around for months and then they kind of fade out and your body can get reinfected. That's why we have part of the problem with the flu and the colds is the viruses mutate just a little bit. The antibodies are no longer recognized. So it's like getting a new cold, a new flu. My fear is this COVID virus will mutate like the flu to where this comes around every year. And if it does that, we're going to be having this problem every year. It's going to be crazy. But we don't know yet. We really don't know how long. I've read of 2 case studies where 2 people that were COVID positive got over it and then contracted COVID a second time, but only 2, and they may have been immunocompromised. We don't know. 2 is not a very big number out of thousands and hundreds of thousands. So for the most part, we're thinking and hoping that these antibodies are going to hang around for months, if not years, but we don't know yet.
Gotcha. I know I've been hearing 90 days or so, and I've heard people say, "Oh, I've had my COVID and I'm good for another 3 months," or is it?
Yep, we really don't know.
Just don't really know. Let's see here. Janelle asked, "What are your thoughts on donating blood if you have antibodies? Is that still being used for those that are sick?"
Yes, as far as I know, there are still some ongoing research and studies using that, and I've seen some studies that actually shown they've given that to some people that have recovered rather quickly. So there is some positivity to that kind of research. So I would say as long as the donation places are saying, yes, we need that, we want that, give it to them.
All right. And we had Hannah here ask a question. Hannah's from my office. What are some ways and resources employers can support staff mental health during COVID-19? What is, it's hard knowing what to do, and how can we support some of those staff members that either have it or have had to go home and work from home, or, what are some things we can do to support them?
Yeah, this whole, the mental stress of being confined at home, the mental stress of, my wife she's just really fearing COVID. She's had several family members that's passed away, and she's not in the best of health herself, and she's just really still fearing it. So there is a lot of mental stress that goes with, this whole thing. So as an employer, I think the best thing is to be positive and implement some of these things that we're talking about, to implement safety, to just try and keep all workers, show that you're trying to keep them as safe as possible by implementing these rules. Take temperatures, do symptomatic surveys. If somebody's off their normal day, get them out, get them talking to a doctor, get them tested if need be, because the other workers are afraid for that person to come back. That's part of this mental stress. If they're working at home, now that's a little different than what we're talking about, people working in close quarters together. If they're working at home, it's almost like cabin fever, right? What can an employer do? At that point, it's not the physicality because they're not there with the other employees, but maybe you could have kind of a Zoom meeting and have some sort of just a 5-minute something upbeat. I don't know what the topic would be, but get everybody together to say, hey man, we're doing this. We're going to make it. Everything's, just be positive and give them something upbeat and a little rah-rah session to let them know, A, you care for them, and B, the outlook is positive. We're not going down the drain. We're going to come out of this. It's all going to move forward. We just have to keep working together, and you just got to keep reinforcing that.
Yeah, absolutely. And you make a good point. It's also looking out for those employees that are still in the office that are in fear of that employee coming back and still having COVID, or
Sure.
just reassuring them that you're taking the necessary steps to take care of
Sure.
the employees that are.
And let's not only the mental stress of the employees working there, worrying about other people coming in as employees that are. Think of if you have any customer base that walks into your establishment, they want to know. So, like, we put up a big banner in front of our building that says, all our employees are COVID tested to maintain a COVID-free zone. And that gives the public walking into your building some confidence. So if that's something that, if you can implement some sort of a testing strategy on a random basis or a monthly basis to kind of help, it's nice to put that out for the public. And that would probably even make some of the employees feel a little safer that everybody's being checked. Every once in a while, everybody's being checked. We're trying to maintain some safety standards here.
Yeah. Hannah had one more question. How should we communicate around return to the workplace? So I'm thinking she's meaning, how should that employer communicate to their employees that someone's returning? Anna, I think that's what you mean. You can comment if you need something else there.
Yeah, that's a little kind of open-ended. I'll throw some ideas out, and if that doesn't hit it, she can give us a little more clarity. But first and foremost, the company has to have some written policies and tell the employees these are the policies, and keep that communication line open. We want to evaluate you again, like for the fevers or the symptomatology. Every day when you're coming in, we're going to do this to try and protect you and the rest of the workers. We're going to do maybe some kind of timely COVID screenings to protect you and the rest of the workers. If you're sick, tell us immediately. We're going to get you to a provider that can evaluate you quickly. You're not going to, be sitting at home for 3 days feeling bad because you can't get into a doctor. The company needs to, I think, take a little step on saying, we're going to have a relationship with somebody, a medical facility somewhere that we can get you in, get you looked at, do a televisit immediately, maybe physically have you looked at to make sure you're taken care of quickly and well, and keep you and your family and the rest of our working family safe and healthy.
Are you seeing that on some of your smaller staffs as well, that the company is making that contact and getting that employee into a testing? I know larger employers, that's a little bit.
Sure. Yeah, we're having that from across the board, small, medium, and large. It's just, again, it's HR's responsibility to take the bull by the horns and make this a straightforward process to where people aren't just willy-nilly, being sick and you never know, what do you have? I can't get into my doctor, so I'm just laying at home for 3 or 4 days. I mean, there's just too much uneasiness and unknown there. We need to make a relationship where the company and the employee and the doctor are a triangle with all three talking to one another as quickly as possible, getting things figured out, getting tested as quickly as possible. Speed and communication is the only way we're going to wrap out of this thing, because we have to just know as fast as possible what's going on, who's got what, and then deal with it as it pops up. So speed and communication are your 2 key things.
Awesome. Do any of our other viewers have any other questions? Please put them in the comments. Dr. Riker, do you have any closing comments? Or, we really appreciate your time today. We've been on here for a little bit, just learning a ton of information, and it's all things that we may know, but putting it into words and really understanding it is important.
I think that's probably the key thing today, is to know that you should have a process in place. It should no longer be, I don't know what to do. Now you should know what to do, put those steps in place, and just start to implement them on a regular basis. That and the communication lines, that's the only way we're going to work ourselves out of this mess. With a parting idea here. Typically, wintertime, everybody is more indoors than outdoors. Typically, that's when flu season comes around. We're more enclosed. We're more on top of one another. We're not outside in the fresh air doing stuff. Plus, we have Thanksgiving, Christmas, New Year's are all normally get-together times, right? So my forecast is, and if you look at the charts that are in like the Texarkana Gazette with the graphs of COVID, it's sweeping up. And this, we still got to go through the next probably, December, January, February is our cold months. That's when everybody's going to be inside. I think we're going to have a tough time unless we all kind of do our due diligence and follow these protocols. It's going to keep swinging up. This is not really going to break until March when the sun comes out, it gets a little warmer, and people start to get back outside. So we all got to kind of hold hands and deal with this for the next 3 months. So hopefully some of the ideas and protocols that I've given everybody will help them ride this storm out and make things smoother instead of I don't know what to do. Now you know what to do. You just got to implement, put them in place, get those lines of communication open with a doctor's office that can help you take care of your people as fast as possible in the best way. And we'll make it through this. It's going to be a little tough over these next 3 months, but then it's going to break and things are going to get a little easier.
Well, we appreciate your outlook and your positivity. I think you said hold hands through this. Let's not do that. But
Figuratively.
Figuratively, we'll hold hands.
Or
keep it wireless.
With gloves and masks.
Yes, that's right.
Our Christmas party is not going to be the same this year as it was in years past.
That's right. Yeah, same here. All right. Well, thank you so much. Guys, I'm going to throw this slide back up here. A lot of you said it was very helpful, so I just want to put that back up for a minute if anybody wants to look at that. This should stay on Facebook. Like I said, this is our first time of doing this, but you should be able to go back and watch it. And if anybody needs the slides, I will post a comment with my email address here.
And Natalie, I don't mind if someone has other questions or needs help from me. I do not mind. You can post my name and the clinic's phone number and address. They can call us. They can get information. We can help them. Whatever it takes to keep the wheels turning, keep this economy running.
Okay. What is your telephone number at the clinic there?
It's 870-773-7246.
Okay, I've got that in there, and that is Architects Health Center. And, I think our greatest question was from LaTanya, that she's just really struggling with the time involved of trying to find those people that do either the on-site testing or regular testing. So if that's something you can help with, we would greatly appreciate it. But this information has been super helpful, and we thank you for your time, and just look forward to it. Guys, I will end on a few things we have here. We will be doing these live interviews throughout 2021. So if you've got any ideas or content that you are looking for, we'll be taking those ideas and getting those lined up, hopefully doing them throughout each month. If you're a member of the Texarkana Chamber of Commerce, we have our annual celebration, which is on January 28th. And we are doing that hybrid. We're offering the live stream, and then we're also offering safety protocols in person as well for anyone that feels comfortable doing that. But of course, masks are required, and we're at a limited number of people there. But also offering that live stream as well, and you just get in touch with me. I put my email in the comments, so if you have any questions about today or anything going forward, please let us know. All right, thank you, Dr. Raker.
See you later.